All right, so Bismillahirrahmanirrahim. So we are discussing about the neuroanatomy, and this is the second part of the neuroanatomy, right? So we have discussed the various Brodmann areas, and we have discussed the demarcations for the different lobes. So let's talk about the what happens when the blood supply of specific lobe is hampered. So what's going to happen? So let's discuss the features of that. So this area that I have shaded in the purple, so this is the frontal lobe basically. So we have the areas like we have got this on the medial aspect. We have another area that is called as the paracentral lobule that is responsible for the urination, right? So in the frontal lobe we have Brodmann area 9, 10 and 11, and these are called as the prefrontal cortex, right? And this is responsible for the I enumerated a few mnemonics in the last lecture, so this is one of them. So we have the package mnemonic for that, and this this states that P stands for the problem solving behavior, right? A stands for the abstract thinking, C stands for the concentration, and then O stands for orientation, and J stands for judgment. So this is responsible for Brodmann area 9, 10 and 11. Prefrontal cortex is responsible for these features, right? So okay, so we have another area that is called as Brodmann area 8 in the frontal lobe, that is responsible for the this is called as the frontal eye field. This is responsible for lateral conjugate gaze. And we have area 44 and Brodmann area 44 and 45. This is called as Broca's area, also known as motor speech area, right? And we have got another important area, Brodmann area 6, that is called as premotor cortex, right? And this is responsible for planning of the movements. And we have got the primary motor cortex that is responsible for the execution of the movements, right? So this is the Brodmann area 4, and I have drawn a homunculus here. So if this is the left hemisphere, so this is gonna control the right we know that the bulbar fibers, we have corticospinal fibers, and we have pyramidal tracts, and they cross it at the level of medulla. So decussation fibers will be, this, if this is the left hemisphere, this is going to control the right side of the body. So this is basically representing the so this right half of the face and the neck and the trunk and the upper limb, right, and the lower limb. So this is controlling the basically the right half of the body, right? So I have drawn a homunculus here. So right, so these dotted lines are actually, this is not a chi sign. Chi kabila ka sign nahi hai like that. So this is not that sign. Basically these legs are dangling on the medial aspect, right? So homunculus, we have the legs on the medial aspect. These are supplied by the anterior cerebral artery. So when we cut out the blood supply of the anterior cerebral artery, so what's going to happen, we will have these features, right? So the legs will, leg area will be affected, so patient will be having spastic paraplegia or monoplegia, right? So and we'll have the features like patient is gonna have the antisocial behavior. Patient will be very aggressive. Patient is gonna have the personality changes, urge incontinence, right? We know that paracentral lobule is on the medial aspect, right? And patient is gonna have lack of interest, that is called as apathy. Patient will be having the abulia, that is lack of desire to speak, right? And primitive reflexes will reappear, like grasp reflex. If we put anything in patient's hand, so he's gonna grasp that. So this is the these primitive reflexes will reappear. And there will be rooting reflex. If you tap on the cheeks of these patients, they will be, look for the just like babies, they're gonna look for the breast. So all right, so another thing is the magnetic gait. So patient won't respond to the life-threatening situation, like if there's an earthquake, so they will keep sitting there, right? So that is called as magnetic gait. So this is basically called as gait apraxia, right? So along with these features, patient is going to have the features like lack of motivation, right? Motivation, the patient is going to have depression like features. So all of these are collectively called as the Finney's Gaze syndrome. Finney's Gaze syndrome, right? So this is the this is what happened when we block the anterior circulation of the frontal lobe, right? So right, so I already demarcated a line in the previous video that almost this area is supplied by the middle cerebral artery, right? So whole of temporal lobe and a part of the parietal lobe and a occipital lobe, right? So this is an a part of frontal lobe. Basically temporo parietal region is supplied by middle cerebral artery. This is gonna arise from here. Then we'll have the superior division, and then we'll have further branches of that. Then we have got the inferior division and further branches of that. So patient is gonna have the, if MCA is blocked, so we'll have certain features. I'm going to discuss that separately. So that's all about the frontal lobe. So what if we um, this is the primary somatosensory cortex. What's going to happen if we disturb this one? We will primary somatosensory cortex is responsible for primary sensations like we have the pain, pressure, proprioception, touch, temperature, and two-point discrimination and vibration. Right. So these are the primary sensations that are perceived in this area. Okay. Then we'll have the another area that is called as the. This is basically, this whole is parietal lobe. So let me highlight this parietal lobe. Okay. So this whole is yellow is parietal lobe. So upper part is Broadman area 5 and 7, right? This is called as the superior parietal lobule, and this one is called as the inferior parietal lobule. Both have different functions. So let's discuss the dominant parietal lobe. What is the function of dominant parietal lobe? Right. So dominant parietal lobe is responsible for left to right orientation, right? And this is also responsible for the calculation, maths. Also responsible for the bringing thoughts into writing. Like if I ask a person to draw a bird, so he's gonna first think, then he's gonna write. So then he's gonna draw. So those patients with the damage who have damage to the dominant parietal lobe, so they won't be able to do so because of this loss of this function, right? So another important function is the speech. So we'll have this Broadman area that is called as Broadman area 22, that is also called as Wernicke's area, also known as sensory speech area. So patient will be having loss of speech, right? So this area is supplied by middle cerebral artery, right? So let's talk about the features of the non-dominant parietal lobe, right? Dominant means if mostly we are right-handed people, 90 to 90% we are the right-handed people, so our left side will be dominant. So this is the left side, and non-dominant is the right side, right hemisphere. So non-dominant is responsible for visuospatial skills, right? If we ask the patient to uh, ask the patient to draw structures like that, ask the patient to draw a star like that, ask the patient to draw these two structures like that. So he's gonna first look at it, then he's gonna understand, then he's gonna draw. So in these patients, when there's damage to non-dominant parietal lobe, so they will be having the loss of visual spatial skills, right? And if we ask the patient to draw a clock, so like that, okay, so this is 12, 1, 2, 3, 4, 5, 6, like that. So he won't be able to draw. He might draw on the just on the single side. So this is called as the constructional apraxia. Constructional apraxia, right? So when there's damage, so there will be loss of visuospatial skills, and there will be constructional apraxia. And another thing is that patient is gonna neglect on one side of the body, like if he's eating on the plate, so he might eat on the just on the one side, just on the right side. He might neglect the other side, right? So this is called as the hemi neglect, right? So this is called as the hemi neglect, right? Okay, so what's gonna happen when there's damage to the dominant parietal lobe? So there will be loss of left to right orientation. There will be left to right disorientation. Patient won't be able to bring thoughts into writing, and that is called as agraphia, right? That is called as agraphia, and he won't be able to calculate. He won't be able to do the math. So this is called as the acalculia, right? And we know that most of the this whole area is supplied by Broca's area, then the arcuate fasciculus, right, and the sensory speech area. All of these are supplied by MCA, middle cerebral artery. So there will be global aphasia, right? So agraphia, acalculia, aphasia, and left to right disorientation. This is called as the just man syndrome, right? So this is called as the just man syndrome, right? Okay. Okay, what happens when there's damage to, that's all about the functions of the left and right parietal lobe, right? So let's talk about the functions of the occipital lobe. So we have the Brodmann area 17, that is primary visual cortex. Then we'll have the Brodmann area 18, that is 18 and 19. These are called as visual association areas, right? 17, 18 and 19. Okay, so what happens when we have dual blood supply here, like middle cerebral artery is also gonna supply this area, right? MCA is also gonna supply, and then we'll have the another branch of we have the P1 segment of the posterior cerebral artery that is gonna supply the midbrain, right? And then P2 segment is gonna supply the occipital cortex, right? So the rest of the segment of the posterior cerebral artery is the P2 segment that is going to supply the occipital cortex. So what happens when we block that? So let's discuss the features once we block the occipital cortex. So let me highlight this occipital cortex, right? Okay, so this is the basically, right? So this is the occipital cortex, right? So okay, so patient is gonna have the features like this. Okay, so patient is gonna have the when we block the P2 segment, so patient is gonna have the visual hallucinations, right? Okay, so the another thing is patient might have the feature that is called as palinopsia, right? Palinopsia. So patient is gonna have the palinopsia means persistence of image even when the object is removed from field of vision. We show an object to the patient, then we remove that, so there will be persistence of that image. So that is called as palinopsia, right? So this is a feature of the occipital lobe damage. Another thing is that another feature is asimultagnosia, right? So if we show the two objects simultaneously, patient won't be able to appreciate those two objects, right? So this is called as the asimultagnosia. Another thing is the cortical blindness, right? So patient will be having normal pupillary reflex, but the patient won't be able to see. That is called as cortical blindness. But normal pupillary reflex is because those information are laid in the brainstem, right? So if brainstem is okay, so patient will be having normal pupillary reflex, right? So I already narrated this thing that P1 PCA P1 segment of posterior cerebral artery is gonna supply the midbrain. So if this is okay, so patient just P2 part is hampered, so patient is gonna have the cortical blindness. So patient is gonna have the normal pupillary reflex. So central vision is sometimes is spared because that is supplied by anterior cerebral artery, and some branches of the posterior middle cerebral artery. So patient is going to have the gun barrel vein, like gun barrel. So patient may be hopeful, right, that is will, some island of vein or okay. So patient will be hopeful that his vein will recover, he will come back. So basically this when the bilateral distal posterior cerebral artery is blocked, so we'll have these features, right, like cortical blindness, and the central vein will be spared, and patient will be having some island of vein that are spared, and patient will be having if like we see through the gun barrel, right, that is called as gun barrel vein, right. And patient will be hopeful that his vein will be recovered. So this is basically called as the Anton syndrome, right. This is called as the Anton syndrome, and that is seen with the blockage of bilateral distal posterior cerebral artery, right. Okay, so that's all about the features of the occipital lobe damage. So there will be visual hallucinations, there will be palinopsia, asymptogonosia, right, cortical blindness, and there will be gun barrel vein, right. So that's all about the features of the occipital cortex when there is lesion in the posterior circulation, right. So let me highlight the temporal lobe, right. So let's discuss the features of the temporal lobe. Okay, all right. So this is the temporal lobe. Okay, so we'll have the primary auditory cortex in here. So we'll have the olfactory area in here, right. We'll have the hippocampal area in here. So what's gonna happen when there's damage to the temporal lobe? So we know that on the medial aspect there will be hippocampal area, and that is responsible for short-term memory, right. Short-term memory, when it is lost, so there will be antegrade amnesia in these patients. So patient won't remember what he's eaten, what he has done, right. So that is called as antegrade memory loss. Okay, this is responsible for short-term memory, and neocortex is responsible for long-term memory. All right, so we know that we remember people by face. We sometimes we don't recognize people by we forget their names, but we remember the face. That is basically a combined function of the temporal plus occipital cortex. So when this is impaired, so patient will be having features like prosopagnosia, and there will be complex hallucinations, right. Patient might feel like there is rotten fish or dead rat in there, and patient might feel like metallic taste in the mouth. And we have the primary auditory cortex over there, and this is because of the olfactory. We have the olfactory area, that is called as Brodmann area 35 on the medial aspect of the temporal lobe. So when there's damage to that, we'll have complex hallucinations. Patient might hear the music, right, because the primary auditory cortex is there, right. So this Brodmann area 41, 42, that is called as primary auditory cortex. So when we damage that, so patient is gonna hear the music. And there's deja vu, like this is called as undue familiarity, right. Undue familiarity, like I don't know the person from the beginning, I had never seen the person, but these patients, those having the temporal lobe damage, so they will be very happily welcoming that person. He might start interacting like that, is that you know the person for years, right. So this is undue familiarity, this is called as deja vu. And patient might have features that is called jamais vu, right. This is unfamiliarity, he may not recognize his wife, right. Okay, so this is called as jamais vu, right. So we'll have the features like short-term memory loss, we'll have the prosopagnosia, complex hallucinations, deja vu, and the jamais vu. So these are the features of when we damage the temporal lobe. So that's all about the right. So that's about the okay. right? So that's all about the second part of the neuroanatomy, right? So I'm going to discuss the posterior circulation in the next video, right? That's all for today.